But my name's Hope, and today I'm going to be talking to you all about the work I did with the District of Squamish, looking at the health impacts of urban density. So I'd first like to acknowledge that I am presenting from and living on the unceded territory of the Squamish Nation. I would also like to take this time to thank my supervisor, Matt Gunn, for taking me on to complete this project and be a part of the bigger vision in creating more density in Squamish. And I'd also like to give another really big thank you to Dr. Victoria Barr for all of her guidance and expertise throughout this experience. So to start, I'll just give a brief outline of what I'm going to touch on today. So I'll give a bit of a background information and then touch a bit on my work completed, both my report and the other projects I did for the district, a bit of next steps, and then take your questions. So I'm going to start pretty broad and just to set the stage about how planning policies regarding density can greatly influence the health of the population, and that's Squamish. So we're all quite aware of the social determinants of health, and our physical and built environment is one of them. The built environment captures the intersect between how our environment can impact our health, both positively and negatively. Before I dive into anything related to the impacts of density specifically, it is important to understand the role of the overall built environment. This diagram is part of the Healthy Built Environments Linkages Toolkit, which I relied on greatly to both guide my literature review, as well as just capture a definition of the built environment, as well as how it relates to planning policies. So that's that. So to start into density, development patterns can create our built environment and cause them to be supportive and resilient, or inequitable and create poor health outcomes. Urban sprawl is an example of a development pattern which has had major impacts on health. So what happened was communities began to grow outwards as personal vehicles became more accessible and property values increased in urban centers. So what happened is people moved to the newly developed suburbs. With this came some infrastructure changes. So things like highways, roadways, all expanded to include more personal vehicles, as well as things like larger parking lots and increasing single family home developments. This uncontrolled development around the periphery of cities became widely known as what we call urban sprawl. So to compact some of these impacts of urban sprawl, planning strategies were needed, and smart growth was one of them. So what smart growth does is it works to do the opposite of sprawl, and it really considers the health impacts of the built environment. So just a brief overview, smart growth development has a strong focus on compact, transit-oriented communities that will support active transportation and public transportation, as well as mixed-use development. This means there is less of a focus on single family homes and large suburban areas, and more focus on building up on existing developments and mixing both commercial and residential land uses. So what does this mean for health? Quite a bit, actually. And to touch on it briefly, this is where the bulk of my report focused on. So after an extensive look into the literature, which was a mix of both peer-reviewed journals from planning and public health sources, as well as some gray literature from both of those areas, I found three major themes which I focused on, which were active transportation, the environment, and social connectedness, as represented in these three pictures, and then the overall equity considerations that kind of pull everything together. So touch on briefly, things like active transportation improve. So we see with higher density and smart growth principles, people are walking more, biking more, taking public transportation to get from point A to point B, which comes with the obvious things that come with increased physical activity in terms of health. So lower heart disease, those types of things. We also see a major preservation of the natural environment, which is a big deal for health. So we see with the reduction of personal vehicles, we're seeing a reduction in greenhouse gas emissions, as well as a reduction in the destruction of the surrounding areas because we're building upwards rather than outwards. So again, this has major impacts in terms of our watersheds, our natural environments, and those types of things that impact our health environmentally. We also see people just become more socially connected. So when you're closer, it's way easier to become more connected. And when transportation improves, and transit becomes easier, as well as those mixed land uses. So when people are closer to the places they like to work, they play, they socialize, it becomes much easier to have things like parks, cafes included in your residential areas, shopping opportunities, all those things kind of become one versus having your residential area here, your commercial area here, and having to always drive to get between the two. Then in terms of equity, I'll touch on briefly. There's quite a few things, and I could talk all day, but one of the biggest things is housing cost. So the price of land in British Columbia is astronomical and becoming unachievable for many people. So if you think about the price of land, if you put one single family house on your property, you're paying for that entire property. But as density increases, we can start to see different housing options become more achievable. So we can look at, even just a coach house to rezoning in terms of adding more density in terms of condos, townhouses, those types of things. So housing becomes a bit more achievable, both rental and home ownership, depending on the level of where people are at. Again, with building upwards, we see improvements to existing infrastructure. We can see things like lower utility costs. Buildings are typically greener with smart growth. So we can see things like electricity, gas, those types of things go down, lower property taxes with things such as, we're focusing on the existing infrastructure rather than having to support brand new neighborhoods. And again, with transportation, we in Squamish actually can't increase our transportation network until we achieve a very specific density. So we can't even add more frequent stops, add more routes until we get to a certain density target. So that's brief on that. And I could talk all day. So what does this mean for Squamish? There's been a major increase in growth in Squamish in the last little bit. Our population is still sitting around 19,000, which is small compared to something like Vancouver and those surrounding areas, but it's becoming vital where we need to work on managing this growth. And again, still maintaining the values that Squamish holds close. So the district is working on making some of these policy changes, which we've outlined in the official community plan. But with this, there's been some minor efforts with major pushback. So this has been one of the big hurdles that Squamish has had to face. So just a brief overview in terms of where I came in. I created a webpage to highlight some of these key concerns to share with the district or with the community, So a lot of knowledge sharing for community, for further community engagements, as well as a big report for my findings. So the webpage again showed to the health outcomes. And then I tried to frame everything in the unique context of Squamish and highlight the concerns of the community, which is a big piece of this. Sorry, I'm rushing through this now. Here were some of the quick screenshots that I took from the webpage that I created. It's still under construction, but just to highlight some of the key points that I had in there. And in terms of implications for Squamish and public health, this is again to set up for continuous efforts of community engagement over the next year or so. And we're still trying to find ways to engage with all citizens, especially those harder to reach and during a global pandemic, as well as this just demonstrated the deep connection between planning and public health. This practicum is a great example of this, and it showed the need for this work, and I'm hoping to see this continue to expand. So thank you. If anyone has any questions, I'll gladly answer them because, again, it's hard to talk about this in 10 minutes. And congratulations to everyone. I'm so impressed so far.